Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina. We have 2 very special guests today from Project Dignity of Western North Carolina. Barbara Morgan is the founder and president. And in 2016, she discovered through a family member in crisis that personal care, soap, and other non-food items cannot be purchased with food stamps. She learned that low-income and homeless women can often find shelter and food, but had no place to turn when it came to feminine hygiene products. In an attempt to preserve their dignity and sense of self-worth, girls often skip school, and women who work in low-paying hourly jobs forfeit income when they miss work because they lack access to menstrual products. Barbara gathered several friends and founded Project Dignity of Western North Carolina, and the challenges were daunting. They needed to find financial support, locations where donors could drop off products, a place to store them, and an efficient way to distribute the products to numerous charitable organizations, in addition to all the middle and high schools in Henderson and Buncombe County. In 2019, Barbara was awarded with the Athena Leadership Award winner for Henderson County. Congratulations on that.
Thank you.
From its inception, Barb has guided Project Dignity as it became an important contributor to the well-being of local girls and women. And although she suffers from a life-threatening medical condition, Barb modestly thanks others for making her life more meaningful and says, quote, "Project Dignity is a means for us to honor the dignity of the women and girls we serve," end quote. Again, welcome to our program, Barbara. So glad to have you.
Thank you.
Of course. And joining her, we have Debbie O'Malley, who is the Vice President, Outreach and Distribution Coordinator. Welcome to Pisgah Health Today, Debbie. 8 years ago, Deb traded in her mouse ears and moved from Orlando to Hendersonville, having retired as the Director of Religious Education in the Orlando Diocese. Active in her new parish, Deb was looking for something to make a difference in our community, and she was invited to join the board of Project Dignity and was immediately instrumental in developing the processes needed to meet the demands of providing feminine hygiene products to the women and girls in the area. Deb works to successfully sustain the logistics of the program, including inventory management, product delivery, and telling the story of Project Dignity to everyone she meets. I am so excited to have both of you women here to talk about this incredible nonprofit. Deb, why don't you start by just telling the organization a little bit more about Project Dignity of Western North Carolina?
Go ahead. Well, thanks to Barb, I got involved, and it came at a really good time in my life because I was looking for something to get involved in, and just really frustrated with not knowing where to put my energy. And I got a phone call from Barb, and she said, I just came across this idea, and I want to know what you think. And I laughed, and I said, I know nothing about nonprofits, Barb, but I'm with you. I think it's a great idea, and I'm willing to learn. And we kind of just went from there, excuse me, with a group of people flying by the seat of our pants, but, did all of the due diligence and learned about nonprofits. And with Barb's inspiration, we just forged ahead, and we've amazed where we've come in 4 years.
So Barb, tell us more of the backstory here. I mean, it sounds like you saw a need and then you said, we need to go after this and fix this problem.
My son was the one that had the issues that led him to become part of the group that lives on government funding. And he was the one that called and said, I can't get non-food items. And so we got to talking about it, and I called a friend of mine in Mississippi who I used to work with at FedEx, and she had done a Project Dignity down there. And we talked about it, and I said, okay, we can do this. We can help these women. And right now in the state of North Carolina, 1 in 5 women and girls between the age of 12 and 44 live below the federal poverty line. That's a
Wow.
lot of women.
Wow.
Yeah, and people don't normally know that. And so the need is growing rapidly, especially with COVID. But we just felt like that we had enough support in the community. And when we first got started, we went to the school liaison office for homeless children. And they were able, it was Christina Smith, and she was able to present our story to the key people that we had in a room for a press release. And it's just been blowing and going ever since. Sometimes I think the board just wants me to be quiet and not add any more locations. But, you know, there's people out there to care for.
I am sure they're very excited that you're being so assertive in going after and pursuing all of those opportunities. That's an incredible statistic. 1 in 5 of age 12 to 44 living below that poverty level. That's a
Yes.
staggering statistic. So, wow. Well, how has the grant that you received from Pisgah Health Foundation, specifically, how is that helping you to meet the needs there in Henderson, Buncombe County and perhaps other places across Western North Carolina?
Well, it allowed us to start expanding. We had started just with Bumpkin and Henderson County, and we knew that we would go out beyond that. And we first went into Polk, Transylvania, and Rutherford County. And then there was a lady in up in Yancey County that had called me in August of 2018 talking about how she needed product and how could we get this to her. And I said, we don't have any method right now to do that. Well, in August of 2019, I called her and said, okay, let's start talking about this. So she came on, and then she spread the word, and Mitchell County, Avery, Madison, and Yancey and Haywood County. We brought them all on once we figured out that we were going to be able to get your support financially to sustain this. We've always been leery because when we very first started, the people that we dealt with in Bumpkin and Henderson County said, y'all need to be serious about this. We don't want you to start and 6 months later call us and say, we don't have any more product, sorry.
Yeah.
So when we wanted to expand, we had to have the financing lined up in order to do that. And you all made that possible.
Yeah. We worked for almost 2 years to just really make sure we had enough product to be able to work. In those days, we were happy to have 2 months worth of product on hand. And that's why the grants have been so critical, because that allows us to buy product and package it and have it as on hand. So every time we process the delivery for the month, rather than worry about, am I going to have enough for next month, I can go into the storehouse warehouse in the back and bring out tubs that we've already packaged because we've had that resource of the grants.
Deb, share with Angela and the team about how much product we shipped out last month.
Last month we did, got the figures right.
Hang on, Angela.
Just for last month, let's see, I've got the wrong page here.
This was for 6 counties, 10 counties, yes.
Yeah, this is for 10 counties. Now our total monthly distribution is 35,314 pieces of product. That's tampons, liners, and pads. For 10 counties, it's 148 schools and 57 agencies that we provide for. And I've gotten several calls this week with, people saying, we really need more. Can you give us more? So I've just updated those figures in the inventory. So it will go up a little bit. Annually, it's 848,700 pieces that go out.
That's incredible. Deb,
Who would
I'm
have
sure
ever
those,
thought?
I know. And it brings a whole new perspective to inventory management, product delivery, and those processes that you're putting together there, Deb, to help bring it to life.
It's a lot of work, but and like I said, our main goal is that we have enough to supply the need. And again, I can't stress enough how the grant has helped us to have that surplus on hand, so that like when I got the call yesterday from one of the groups that just said we've had 500 families come through here this week. We need more product. They've never been able to offer this product. No one thinks about this.
Right.
They're happy to provide canned goods and other items. And I delivered to IAM yesterday, and the gentleman said, "Wow, we are totally out. I'm so glad you came today." He said we had 800 families. And he said they
Wow.
just don't even realize, this is money that they're not going to put out for these products if they have to buy food and other things, medicine.
Mhm.
So, it's just a need that we were not really aware of. And it's just incredible how well it's taken off and how appreciative people are that there is a service that does this.
And it's life-changing.
Yes.
People think, oh, it's just a pad, it's just a tampon. But at one Rotary meeting, we had a lady stand up, and she was pretty emotional, and she said, I have to tell you this. When I was in junior high, I stood up to leave class, and I had blood on the chair, and I had to leave school. I wrapped my sweater around me, and I left school. And she said, I was so embarrassed. I have never shared this with anyone. And it's, she was in her 60s. So it is impactful. And, when you think of bullying today and the girls in school, plus if they miss too many unexcused absences, then they don't get to participate in sports, and how important sports can be. And they may have to take the class over again. So it's just not a simple thing, and that's not including the moms or the women that are working and usually low income jobs. And now it's not including all of those families that, are coming, the 800 that are coming now that never had to come to a food pantry.
And COVID's been a big part of that. People that have lost their jobs, and they have no disposable income. They're going to buy the bare necessities, and anything else is a blessing that they can get.
Well, I think as you both said, this is a need that is often, it goes unnoticed. And yet the name of this nonprofit, Project Dignity, says so very much about what you're providing for these young women and girls with the work that you're doing. Barbara, what
I
else
think
would you like?
go ahead.
No,
Go
no,
ahead. I'm
please
sorry.
proceed, Debbie. Please proceed.
I just think that's the overarching real reason we do what we do is that, preserving the dignity of these people. It's more than just handing out a product. It's, giving them a resource that's going to impact them on a whole nother level to preserve their dignity in the workplace, in the schools. I can't, it's hard to ask. I've been on food stamps in my lifetime. I know how hard it is. And it's just, the dignity piece, how you treat people, how you respond to their needs is so critical.
That is so well said. Barbara, what else would you like our viewers to know about Project Dignity? How can they get involved? How can they come alongside you all and support the work that you're doing?
One thing that I'd like them to know is a little bit more about my disease. When we started this 3-4 years ago, I was really doing quite well. I have a bone marrow failure disease, and now I get platelets 3 days a week and blood every 2 weeks. And the board just is totally behind me, and they, if there's something I can't do, then they step up. And so the message from me on the first part of this is, don't let an obstacle stand in way of doing good and alleviating the suffering of others, because it will keep your existence going for a very long time. And we are so fortunate to be able to expand what we've done based on the money from Pisgah Health. And, we don't ever meet the women that we give product to. We have people that take the product out, like that goes into Madison County. They know who those people are and they see their faces, but it's strictly a confidential thing on our part that we never know. And we won't know for a long time. So we're making a difference, and you helped us make a difference in all these people's lives. So
Barbara, you're an inspiration, and thank you for choosing to lean forward in a time when it would have been so easy to say, well, I just need to stay focused on the challenges that you're facing, and you didn't do that. You said, no, going to make a difference.
yeah,
So you're an inspiration.
thank you.
Absolutely. Of course. Anything else that you would add to that, Debbie, about what else would our viewers need to know about Project Dignity?
There's ways to be involved. Obviously, we have a website and we have a Facebook page and an email address, and donations obviously are welcome, whether it's product or monetary donations are always welcome too. We try to, it's been a little difficult during COVID to keep our volunteers engaged, but we have packing parties when things are normal. They can come to the warehouse and we have a good time with that, and it's really inspired people. They do miss coming and doing that. Some people can package at home for us if they would like. So there are opportunities for some hands-on volunteering. Obviously our facilitators that represent the counties, they come and do our deliveries, but there is opportunity for some other volunteer hours if people would like to do that, and they can contact us through the website.
Wonderful. Well, Barbara and Debbie, on behalf of the Board of Directors at Pisgah Health Foundation, I would like to say thank you to both of you and to your entire organization for the tremendous work that you're doing to bring dignity to the girls and women in Western North Carolina through Project Dignity. And we are so grateful for all that you are doing and for taking time to be part of Pisgah Health today as well.
Thank you. Well, we
Thank
certainly
you.
appreciate all that you've done. I mean, without this, you know, we would be a lot less well off to help people. So it's organizations like you that really keep us going.
Well, thank you for that.
Debbie would be far more stressed if we didn't have the additional funding right now.
That's for sure.
We have enough stresses in our world in 2020.
Yes.
So anything
Mhm.
to help alleviate a little is
Yes.
good.
Yes.
Well, thank
Yeah.
you again for being part of the program today. And we also want to thank Wildflower Media for their creative and technical support, as well as we would like to thank the Board of Directors and staff at Pisgah Health Foundation and the Physicians Roundtable. Until we see you all on the next Pisgah Health Today, stay well and be well.